Good afternoon, everyone. My name is Sharinda Williams with the Southeast Addiction Technology Center located at Morehouse School of Medicine's National Center for Primary Care. And we welcome you all to our webinar, What Clinicians Need to Know About Methamphetamine and Treatment. Disclosure statement. In compliance with ACCME guidelines, the following speakers have no financial or other relationships with the manufacturers of any commercial services discussed in this educational activity. About SATTC. The 2017-2022 ATTC network is comprised of 1 network coordinating office, 10 domestic regional centers, 6 international HIV centers that are all PEPFAR funded.
I want to welcome each of you all to the What Clinicians Need to Know About Methamphetamine and Treatment. Before I begin this webinar, I'd like to tell you a little about myself. I am a licensed clinical social worker in the states of Georgia and Alabama. I also have a co-occurrence certification disorder certification through the Alcohol and Drug Certification Board. And I have a pretty extensive background in mental health and co-occurring disorder field. I've also worked in inpatient and outpatient settings, and along this journey I've also had the experience of teaching and also auditing mental health programs. I am currently the owner, CEO of LEJ Behavioral Health Services, LLC. And given that, I am really excited about this training today, and let's get started. I always like to begin by talking about the objectives. What is the goal of this particular webinar? What is its purpose? And mainly it's going to be a combination of reminding you of information, updating you on information, and ultimately the goal is to take away some additional skills and knowledge on how to treat this population. So let's start with the objectives. We need to do an overview of what clinician and addiction counselors need to know about methamphetamine and why it's necessary that we continue to keep our lenses and focuses on this very deadly drug. So I'm going to be talking about some updated statistics. I will also talk about some of the signs and symptoms for light users of meth as well as those who are moving into the addiction stage of meth use. We will learn how methamphetamine impacts us from the user from a physical, psychological, and medical perspective. And as always, we must talk about what kind of tools we're going to use. We are certainly going to look at some best practice assessment tools and specific treatment models that I think you will find will be helpful in treating this population. And we will move toward the end of this training talking about not only treatment models, but we will also look at community resources to help meth users and family members. And I hope you all will learn a lot and share with me as we do this training today. So let's begin. What is meth? I mean, this is very beginning information, but again, I want to remind us of just being familiar with what this drug is. And it is a highly addictive stimulant drug that is very much attacks the central nervous system. It's very important that we're aware of that. It is also important that we know that the history of methamphetamines came about in the 1920s, where it was used as a prescription drug to treat attention deficit and hyperactive disorders, and also obesity. And the medication used was digoxin. So again, this drug originally in the 1920s was used for medical reasons, and it later became a recreational drug of abuse. It's important that we look at, how this drug is produced and manufactured, and I'll certainly talk more about that as further into the presentation. Methamphetamine is sometimes prescribed in pill form. And some of the street versions names for this drug, this white powdery drug, and I'll list just a few of those. And as you can tell, crank, beanies, brown, Mexican crack, redneck cocaine, speed, and tweak. Again, there are many other names that is affiliated with this drug of choice. It's important that we know that this drug, crystal meth, is consumed more commonly by smoking out of a glass pipe, such as the way that crack cocaine is used, and I think we're familiar with that. Meth users melt down the crystalline substance and smoke it. Although they certainly use other methods such as injections, snorting, and swallowing, and in some cases they inject the substance into the anus and the urethra. So again, this drug is a very powerful drug and very much impact the behavior uh, and certainly the lives of people who become addicted to it. So let's move a little forward because I want to talk a little bit about some updated statistics about this drug. Uh, and that my data, as you can tell, comes from the National Institute on Drug Abuse, and this is some fairly new data about meth. And for some of you all, you'll be familiar with it, and others, it'll be an update. So we're talking about 6.5% of adults who have used drugs over the last year. And of that particular population, 5.4% were ages 12 years old and above. So as you can tell, this drug is very disturbing because it impacts children at an early age, and children at an early age are using this drug. I also want to talk about a study back in 2000 where they did a study on, this organization did a study on high school seniors, and about 8% of the population had used meth over the year. So again, this drug impacts children, youth, and adults. The heaviest use of this drug occurred in 2012, where approximately 1.2 million people either used it and or was becoming addicted to the drug. It's important that we look at more advanced or updated statistics. According to 2014, over 300,000 Americans became addicted to this drug, and it affected all age groups, and I'm talking about children, adolescents, adults, younger, older populations. It also impacted different social classes and geographic regions. So although we talk a lot about the opioid epidemic, meth is very much a part of a problem that we continue to need to address and treat here in the United States. It's important that we understand that the manufacture of methamphetamine has become easier with a new method of making this drug called shake and bake. And what this method does is allows the producer to actually produce the drug in less than 15 minutes, and is actually able to be used to smoke, inject, or inhale. And interested about the shake and bake method of making this drug, it has really allowed folks to actually produce this drug in the back of their car. The danger is the device is very this drug is put in a bottle, and it could be very explosive. So yes, this quicker use, quicker access to using the drug, but it's also very dangerous, and we'll talk a little bit later about that. And it's important to know that the high lasts from 6 to 12 hours. That's a pretty long time for someone to maintain a high euphoric feeling. And what makes this drug uniquely different from other stimulants is this drug, it remains in the body for 12 hours. That's a pretty long time. When we compare it to cocaine, where a high lasts 20 to 30 minutes, and 50% of the drug is removed from the body in 1 hour. Again, a great difference in the effect of how long the high lasted with meth and how long it stays in the body, and ultimately when we compare it to a counterpart drug, cocaine. And it's important that we know that meth actually intimidates dopamine and norepinephrine. And these are the pleasure-seeking parts of the brains. Again, it's very important that we look at what part of the brain that is truly impacted by this drug. Many people think meth's instantly addictive, but the reality is it varies by the users. Some people get hooked quickly, and others used this drug recreationally for a number of years before becoming addicted to it. And some of the users of this drug are corporate people, executives, people who have high profile jobs. So clearly this drug is a drug that crosses all socioeconomic background. The long-term abuse of meth can cause a major decline in IQ, induce a state of psychosis, and irreversible damage to nerve cells. Overall, there has been a great deal of evidence that this drug continues to be transported to the United States from Mexico. Again, some information that we really need to be aware of as we work with this population. So moving forward, let's talk a little bit about what this drug looks like. As you can see, there are pictures of the different types of how this drug is physically looks. As you can tell, it's powder form, rock form, and as I stated earlier, it can be smoked, snorted, injected, or swallowed. Again, it's important that we understand that primarily people, they smoke this drug using a glass pipe, very much like how crack cocaine users use the drug. This drug is melted down in a crystalline substance and is smoked. So again, I want you to be aware of what the drug actually looks like. So let's move on. Let's talk about some of the symptoms, signs and symptoms of meth users. And these signs and symptoms are applicable to children, youth, and adult. And some of the symptoms I'm going to talk about now is a mixture of some of the early symptoms of abuse and the more advanced addictive symptoms of abuse. Some of the common things you want to ask when we're doing our assessment is how much is one sleeping, because there's a lot of problem with an inability to sleep, increased sensitivity to noises, a lot of nervousness and scratching. We're going to talk a little bit about the crank sores that the more advanced or addictive meth users subsequently experience. There's a lot of the irritability. We talk about that meth users get very agitated easily and over a period of time. Again, this varies. They do get very irritable because of a lack of sleep, high energy level, and extreme anorexia where they don't eat properly. This drug suppresses their appetite. They do not have a desire to eat. Tremors, and sometimes convulsions. And we're going to talk a little bit later about convulsions, because convulsions can be indicators of them moving into overdosing and needing inpatient treatment. There's an increase in the heart rates, blood pressure increases, and risk of strokes. These are some of the more chronic symptoms of this particular drug. We need to also pay attention to the presence of them inhaling the paraphernalia, such as razor blades, mirrors, and straws. These are things we really need to know. The presence of injecting the paraphernalia, such as syringes, heated spoons, or surgical tubing. All of these are indicators of drug use. And some additional examples of some of the signs and symptoms of methamphetamines are teeth decay. We're going to be talking about the meth mouth person. That's the person who has a lot of teeth decay. And I actually have an example of one that I want you all to see what it looks like. So when we're doing our assessment, we got to be very vigilant of the physical appearance of meth users. There's an extreme problem with weight loss. Drug residue and drug paraphernalia, I talked about that, skin rash, acne. All of these are indicators of someone using meth. And there is another term I want to introduce to some, and to some already know this, is called tweaking. And it's important that we pay attention to tweaking, because tweaking simply occurs when the high starts to fade away and trigger psychotic symptoms, such as hallucinations, delusions, and drug cravings. This again can be very dangerous. So again, it's important that we pay attention to these symptoms because they tell us a lot about what stage the drug user is in and the advancement of this drug. Now, part of this work, it's very important that we look at it's an observation as well as what the client tells us. Our clients are very talkative, meaning substance meth users, so they're very talkative. They exhibit a lot of high energy. They're very restless. And pay attention to their mouth. It's very dry mouth because the saliva glands do not work as effectively when they're snorting this drug. They have the dilated pupils. You oftentimes see sores on the skin from scratching, and these are called crank bugs. And one of the most common signs of long-term meth addict is as we talked about, is the tooth decay. And time would not allow me to show you all the video. Justin, Addicted to Meth. It's a very good video because Justin is very in the advanced stages of his addiction to meth, and you will see many of the symptoms, the observable symptoms in Justin, such as the talkativeness and the high energy level. So again, I did include the web link, and this video is probably 4 to 5 minutes, but I think it'll be very helpful in helping us as clinicians and therapists and providers with this population. So we not only have to recognize symptoms, but we have to visually also be aware of the physical appearance of these individuals. Again, I wanted you all to see pictures of the meth user. The first picture is a picture of a female, and you could tell some of the acne there. She's in probably the early stages of meth use. Now, if you look to your left and my right, you will see an individual who, prior to meth use, skin was fairly nice, and then over a period of becoming addicted, you start to see them. You start seeing the crank bugs, because with this drug come a lot of itching and scratching of the skin, and the result is what this gentleman looks like after a prolonged period of meth use. The other picture at the bottom is a picture of a meth mouth, and as you can tell, the teeth are pretty decayed, and again, a clear indicator of advanced use of this drug. It's important that we talk about some of the effects of meth. We've already talked about the loss of appetite, the increase of mental alertness. Some of the ones I really want to talk about a little bit more is some of the psychosis that comes with this particular drug. They become, and as they start to come down off this drug or begin to fade away, they move into a psychosis where they become extremely paranoid. They have distorted perceptions, auditory and visual, like tactile delusions, hallucinations rather, where they believe bugs are all over them, and they do a lot of scratching, and a lot of time they end up with these crank bugs and crank scars on their face. They have a lot of repetitive motor activity, a lot of sweating when they're using high doses of this drug, and some of the medical related problems are they have increased heart rate, elevated blood pressure, and they also have what they call this jaw tension, where the teeth, they do a lot of grinding of the teeth. Again, this is very, very important that we recognize and know some of the symptoms from a not only psychological but a physical health perspective. It's important that we talk about a little bit more about the duration and signs of this drug, and also when individuals overdose on this drug. As stated earlier, the duration of hit of meth is anywhere from 8 to 12 hours, and some of the research point out that meth can actually, a high can last as long as 16 hours, and again, 50% of the dosage remain in the system up to 12 hours. I also want to point out that when you talk about meth, it's important to talk about ecstasy. which stays in the system for another stimulant that stays in the system 4 to 6 hours. And just to remind that meth is a white powder that's pressed into small pills that comes in various pastoral colors. Um, and ecstasy does a lot with enhancing tactile sensations and sexual pleasures. So when individuals are using this drug, it's very common for them to be sexually active with different partners, and certainly what comes into play is unprotected sex, sexually transmitted diseases, HIV. So again, this drug requires us to have a working knowledge not only on the psychological but the physical and medical symptom that goes with this drug. It's important that we also be aware of the signs of overdose. Um, Convulsions, I talked about that a little earlier. When our clients come in, we need to understand and try and figure out what stage they're in. And it's imperative that we get good assessments. And sometimes we have to depend on collateral contact like family members, significant others, to help us with figuring out the stage of the meth use. But convulsions, we want to make sure that we're aware that convulsions, increased agitation, heart and stroke related problems, extreme elevation in body temperature, and dehydration. And a fatal overdose occurs as a result of cardiac arrest or a stroke from high blood pressure. So it is so important that we be aware of these symptoms. So aware. I want to show you all some pictures of individuals who are in different stages of meth use, and I also included the YouTube video, and it's really a good video. It's titled Faces of Meth 2015, and as you can tell, there's the link right below there. But take a look at some of the individuals in this, the various individuals in this picture. As you can tell, you can see some of the disfiguring of the face. Some people are in the earlier stages. Some people have some of the crank sores. But again, very important to pay attention to the physical appearance of our meth clients. It's also a good thing when they're coming in for treatment. It's really good if we have a picture before they use meth, and then of course a picture as they present themselves to us in treatment. So again, and this video, you all, is about 3 minutes long, and I think it'll be a very good visual aid. Let's talk a little bit about some of the physical, psychological, and medical implications of this drug. I particularly like this study. It was a study published in May 2014 in the Journal of Addiction Biology, and it was a team of Taiwanese researchers who investigated the underlying mechanism of meth as it related to brain damage. And what I want to do is I want to go over some main findings of this particular study, because I think it's very relevant for what we've talked about thus far in terms of how this drug impacts meth users. The researchers found in this study that chronic meth users may experience a sharp decline in normal levels of a specific protein that helps protect the brain's nerve cells. When taken repeatedly over time, methamphetamine can produce lasting damage in the nerve cells, which is located in the brain pleasure center. So again, over a long period of time, it causes a lot of damage to the central nervous system, and particularly the proteins that cause lasting damage for the nerve cells. Meth damage effects also support cells in the brain that help protect nerve cells from contagious microorganisms and remove degraded nerve cells from active duty. It causes memory impairment. That's very important. We talked about the long-term effect of meth is it causes limited IQ, memory loss, and also a reduced inability to think clearly or logically. And it's also impaired the ability to focus and concentrate when working. And a lot of these folks are not able to work because of some of the issues, memory loss, inability to maintain and stay focused. In this test, research also talked about ability to regulate violent, aggressive urges. This was part of some of the findings. Meth can also lead to the highly debilitating state called psychosis, and we talked about this. They over a period of time they start having frequent hallucinations, delusional thinking, and paranoid process, along with abnormal repetition of certain body movements. Some of the damaging brain effects of chronic meth use may be permanent, while others may resolve partially or fully if meth users can stop using the drug for extended periods of time. Uh, Meth, again, is, according to this study, and certainly the research points to that as well as the practice when working with this population, meth is particularly dangerous to repeated users because it triggers larger changes in the brain pleasure center than either amphetamines or cocaine, which are two other most well known addictive stimulants. So again, this study has some really supportive data of what we've been talking about thus far in this webinar, but it also shows clear evidence of the physical and psychological dangers of this drug over a period of time. And for my readers who are very much driven by research, I did the source for this study. It is in the bottom of this slide, and you will find it just has some really good information about this drug and how it impacts individuals over a period of time, how it impact family members, and certainly their ability to work and survival and live. So again, do look at the study. It has some has some really great information that I think is very helpful in our work with this population. Now that we've talked some about these drugs, it's important that we look at assessment tools. The biopsychosocial assessment continues to be very much of a research-based assessment tool because it's very comprehensive. It covers the entire life of an individual from infancy, childhood, stages of development. It talks about physical, psychological, work, family history, very comprehensive information that we need to know when working with this population. But there are some other assessment tools that we really need to consider, best practice assessment tools that can help us when we assess this population. The substance abuse substance screening inventory, the SASI-3, it is a very comprehensive tool, and it's really good because it talks about not just one type of drug, like the cage, for example. It talks about a question related to various types of drugs. Because sometimes the meth user also use other drugs other than meth, sometimes alcohol, and they mix it with other drugs. The ASI, the Addiction Severity Index, is also another good tool that's very helpful in helping tease out the symptoms and severity of the drug users' use of drugs. Another one I want to point out is the ASAM, the American Society of Addiction Medicine, is a guiding tool in helping us look at the level of care that's most types of care and levels of care that's most appropriate for an individual using and abusing and are addicted to meth and other substances. A really nice one that I like is a self-test for methamphetamine addiction. I did list the link to it. Please look at that particular tool because it's very much designed for individuals who primary diagnosis methamphetamine addiction. I want to drop down a little bit to the drug use screening inventory revised. The DASI-ARA is also another good tool. And there are fees associated with some of these assessment tools. And I know this particular tool, I believe, agents that have to buy this particular tool, and I believe it's $3 for each assessment. and they also help with analyzing the data and defining findings. And another tool that I want you to consider too is the personal experience screening questionnaire, and these are for our adolescent population. It is very important that we make sure our tools are user-friendly and such that our, especially the self-assessment tools, um, allow individuals to understand the question and be able to answer the questions. Um, so again, think about some of these tools because they really can be helpful in helping determine the stage of use. It's imperative that we talk some about recommended treatment models. Um, the matrix model continues to be one of the leading models in working with this population because it deals with a plethora of areas within the meth user's life. It deals with it combined with elements from relapse prevention, motivational interviewing, and other proven modalities. Um, One key difference between this model and others is its duration. Many programs last 30 days or less, but the matrix model has a variety of tools and treatment techniques, and it lasts up to 6 months in terms of different techniques. It just covers a plethora of things we can do in treating and help stabilizing this population. Um, it is also very highly structured. It's very workbook driven, and information presented in an easy, understandable way. Because keep in mind, it also helps with there are components of this model that work with families and helping families work with their loved ones. It does also a lot of positive reinforcement, and of course, the 12 step is also important in looking at this particular model. Um, Cognitive behavior therapy continues to be a best practice model in working with this population. It has a variety of interventions, anything from role playing to cognitive reframing to determining how one views the world, and ultimately learning how to reframe and work through issues. Again, a very good model to consider. And a model that I'd like to also talk briefly here about is the contingency management model interventions. It would make this particular management of interventions helpful. It provides tangible incentives in exchange for engaging in treatment and maintaining abstinence. It has shown a lot of effectiveness because it does a lot with like the old behavior modification model, where when our clients exhibit positive behaviors, there's an incentive for the individual to be rewarded for example, going to all group meetings, support group meetings, not using the drugs. Anyway, there are a variety of incentives that can be introduced in the treatment, and in some form of reward for following treatment. So again, a very good model to consider. I want to talk just a little also as we talk about models and motivational incentives for enhancing drug abuse recovery. MEDAR is an incentive-based method for promoting cocaine and meth abstinence. Again, these are 3 to 4 models to consider when working with this population. But I certainly would be remiss if we didn't talk about including in our treatment regular drug testing. That's very important as we develop treatment plan, person-centered treatment plans for this population. There are basically 3 types of tests for meth, and that's the saliva test. It generally generates a positive result within 5 to 10 minutes after usage of a drug or it could be up to 3 days before you get positive results. Another type of test that's very helpful with work with this population is the hair test. It takes up to 7 days for the positive results, and results can be up to 90 days. So again, it takes longer to get the results from this test. And then, of course, the more common urine test, where after about 2 to 5 hours um, per after someone has done an injection, the results may show up as positive immediately. This test can also detect meth for anywhere from 3.3 to 5 days from last use. So again, we do want to look at types of tests when we look at what's going to be beneficial in monitoring the meth use or drug use. And as you look a little bit further in the slide, I want to talk a little bit about medication. At this point, there is no specific medication that prolong abstinence from the abuse or use of meth. However, I'm in a little bit going to talk some about some drugs that may be some possible future helpers in helping meth users abstain from use. Researchers have begun a study recently, and this is it's a methamphetamine monoclonal antibody known as MAB7F9, and this particular meth possibility is looking at the antibodies and looking at if this drug is effective. It may possibly help the meth user abstain from use. So let me go a little bit further into looking at some other trial drugs I think you'll find can be pretty helpful in working with this population. As you can tell, the first drug there is bupropion, and it is another name for this drug as well, Butrin, which is the brand name for this drug. And many of us know this drug has been an antidepressant that we oftentimes see in psychiatric settings. This particular drug focuses on light users of meth. Again, these drugs are all in a trial phase. Another drug I want to talk a little bit about is modafinil. It's the brand name for this Provigil, and it's a control acting stimulant. And what this drug does, if it's mixed with a best practice treatment model like cognitive behavior therapy, it may help reduce meth use, although we don't have any great promises as to how effective this drug will be. And I believe many of us know this next drug, naltrexone, a drug that's commonly used with heroin addicts and opioid overdose. This is another drug that's also being considered to increase the abstinence of meth use. That fourth drug, mirtazapine, is the brand name for this Remeron. It's also an antidepressant medication, and it too is being recommended to work along with cognitive behavior therapy. And what's interesting about this particular trial drug, it was associated with significant reduction in meth use among a sample of men who have sex with men. It seemed to be very helpful in reducing use with this particular specialty group. And then of course another trial study meth drug briefly talk about is the topiramate rather, and this is also a drug that's being heavily being in a trial period, and our hope is that all of these drugs will over time show some proof validity of being effective in helping the meth user reduce and are abstain from meth use. So what I want us to do is really continue to look at the research on these drugs and other future drugs, because we know that drugs um, do help in many cases with reducing and decreasing the use of a drug. You can't do this work without talking about treatment and resources. Again, very important that we talk about treatment and resources. Um, we certainly know individual, family, and group therapy is important when working with this population. Occupational therapy. We talked earlier about some of the problems with this population is they begin to have problem with memory, concentration, and ultimately this can have a tremendous impact on keeping and maintaining a job. They also have a lot of legal problems. This population does, and financial, um, and ultimately um, this population need a lot of work with family education and therapy. Support groups are very important in working with this population. The Crystal Meth Anonymous support groups is certainly a important group to think about. Narcotic Anonymous support groups are important, and of course 12-step programs. I do want to talk a little bit about those folks who are very addictive and may need um, some more acute care. It's important that we look at medically supervised detoxification, and this is really the first step of the meth rehabilitation process for chronic meth users, and the primary focus is on withdrawal, and it requires a team of doctors, nurses, and medical staff, because as I stated earlier, this drug can be very deadly. It can cause strokes and heart attack and death. Um, it's also important that we look at residential inpatient treatment programs for this population, partial hospital programs. Um, it's very important that we look at outpatient meth rehab programs and meth rehabilitation aftercare programs. And meth addiction centers. So along with the treatment, we got to look at what stage the individual is in, um, and the individual who's in the early stages of youth of this drug use can very much benefit from individual group work, family work, and also um, work with support groups and getting sponsors and 12-step programs. But folks who are more chronic and at high risk of overdose um, and just aren't able to quit the drug may need to be in medical detox programs where they can be medically monitored by medical qualified individuals. As we look at this particular training today, I do want to remind us of some important things that we must remember and continue to work toward, and that is we must use assessment tools that clearly give us guidance on what's going on with the client. They're the light users of meth, and they're the users who use this drug over long, prolonged periods of time. It's important that we understand the psychosis side of this particular drug, and so we're not only going to be doing the treatment from a substance use perspective, but we're also going to be doing this drug from a um, mental health perspective and from a medical perspective. It's important that we look at best practice treatment models like the matrix models, cognitive behavior therapy, and some of the other contingency incentive models. Very, very important. And also on this journey, it's important that we look at the promising medications. I talked about 6 to 7 in this particular training, but it's important that we look at these trials and see what the progression as to whether these drugs will work and will not work. Very important that we continue this journey, but it's important that we do our best to meet the needs of this population and family members. So given that, I am pretty much nearing the end of the overall presentation today. I hope it has been helpful to you all. Um, as we look at this drug, we have some obligation to do our best to meet the needs of not only our clients but our families. So I would like Ms. Williams, if she
Okay.
can, to
Yes. Thank you so much, Dr. Cannon. That was a very informative presentation. We got to see things from different types of perceptions, perspectives, as well as getting some really good current information. What we're going to do now is open up the floor to some questions, and we got some answers coming. So we're going to go with this first question from Mr. Robert Nichols. It says, if a client is in a meth-induced violent or paranoid incident, what are some interventions?
if they're in some paranoid incidents, it's going to be very important that that person be seen by a doctor, a psychiatrist, because again, part of that overdose, uh, one of the problems with overdosing a lot of times is that they get extremely violent. It could be some convulsions. It could be the blood pressure is going up. So it's going to be very important that we get that person in ASAP to see a medical doctor, get evaluated, because after all, that person might need a medical detox. And certainly as they get through the stages of the medical detox where you're trying to treat the withdrawal symptoms, you want qualified nurses and doctors there to help that person. Number one, we want to make sure that they don't overdose and die, because they can. And it's imperative that we move quickly and get them quickly evaluated.
He followed up by asking, is the ER the best alternative?
If you're at a setting and the doctor can't say if you go to a mental health center and the doctor is not available to do a crisis or emergent, take them to the ER. And it's important that we communicate what we understand by meth, and let's not always assume people understand substance symptoms, and it's our job to make sure we help inform them of those high-risk behaviors. So ER is certainly a good choice.
Okay, great. Thank you so much for that answer. Here's a question from registration. As you know, when you register for our webinars, you get a chance to ask the speaker some questions. So here is one. Why is it meth use prevalent in the Black community as much as it is in other communities?
Very good question. I looked at some of the research with that. While yes, blacks use meth, but they tend to use a lot of kind of common drugs, alcohol, cocaine, and heroin. And it seems to be very prevalent in Caucasian, Hispanic communities, and meth really has a fairly long history of being a upper middle class executive type of drug, because again, it's fairly reasonable. The high lasts for a long period of time, and depending on the frequency of use, one can use meth for a number of years and could look very appropriate in the workplace. The problem is over a period of time, the behavior changes a lot.
Interesting. And when you think of the stigma that's associated with this drug, you may not think of that demographic as well. I wanted to also ask, Mr. Joseph Kelly says, am I understanding correctly that MAB7F9 is being clinically studied as an MAT for meth users?
That is what I'm understanding, Mr. Kelly. That is still in the trial stage, but it's certainly being looked at. So I think we're
And
just going
we
to have to continue to read and see what and continue trainings to figure out what would be the outcome of these trial drugs.
we have another question from our registration form. How do you recognize the drug flow in a family?
I think being aware of those beginning symptoms that we talked about early, pay attention to the individual who is up all time of the night, not sleeping well, easily irritable. Also pay attention to their school performance, because keep in mind, the more they use this drug, the more the memory and the concentration gets bad. Pay attention to behavioral problems because they get agitated easily, they get into fights easily, they're not concentrating well, they're not sleeping well, uh, and oftentimes they want the next high just to get that good feeling. And sometimes drug use run in families. Sometimes we see families where the child is using drugs and of course the family member. And when we look at alcohol, we see a lot of the first drug, alcohol, is generally given to the child by family members. And sometime in drug addicted family, we see where the adult give the drug to the child. And we just got to do really good assessment, but pay attention to those early warning signs.
That sounds like a pivotal thing to look out for. Another question is, what is the best practice for clients using small amounts daily?
Um, general outpatient services like individual, family, and group work, because in the early stage you can talk about signs and symptoms and get them connected to support groups. Uh, but generally, intensive outpatient is good for that group because you do want to get them engaged. And the goal, of course, at any stage is to get them to the point where they stop and discontinue the use. Now, what you really want to do is watch those really advanced stages. And then we talked some about the meth mouth, and we talked about, some of those other symptoms. And those are the folks that we got to really look at and see if they need more intensive meth detox. But regular outpatient services and getting them involved in group work is very effective in working with substance users as well as meth users.
And we have one more question. It is, what, if any, promising pharmaceutical interventions are there that can assist with the treatment of meth addiction?
Wow. It's an area that we've just got to keep working. Very much like with the opioid population, the pharmaceutical companies have really chimed in, and they're tracking types of medication uses. The problem with meth is it's a lab synthetic type drug, and I'm not sure how we're going to get the pharmaceutical companies more involved, other than we need them to help us with looking at medications and helping with more trials of the various medications we talked about earlier. But they certainly have a seat at the table because we need their expertise to look at the types of medications and if indeed do they really work. I know we talked some about the antidepressant medications has some possible ways of helping decrease the abstinence of this drug. I think we got to keep working collaborative, not only with pharmaceuticals, with doctors, law enforcement, because the other side of meth is this whole labs and explosives. It's going to take all of us, including pharmacy, to come up with not only treatment but also what's the best medications for this population.
Thank you so much for those answers, Dr. Cannon. They're really good discussion we got going on here, and it's good to keep that discussion going in our communities and with other clinicians as well. We want to thank you, Dr. Cannon, for that presentation. We want to thank you for coming and taking some time out of your busy schedule to help us learn more. We want to thank you as the participants for coming and spending some time with us, learning from us. We appreciate you being here. We appreciate your involvement. And whenever you see any of our communications out, be sure to register with our communications so you can get a constant flow of what's going on with SATTC, what's going on with the community, the recovery community as well. And that email address, it will be sent to you in the post-webinar survey. I see someone asked, but again, thank you, Chris, Mr. Coleman. It is ncpcinfo@msm.edu. Thank you so much, and everyone have a great rest of their week.
And thank you.